All right, let's talk about this. Women struggling with hot flashes, weight gain, brain fog, and other menopause symptoms are inundated on social media with how to find relief, but many of those tips or advice are unproven, and that explains why the market for menopause treatments is big and growing. In fact, it's estimated to reach $27 billion, billion by 2030, and there are two big trends right now. One involves taking an antacid and antihistamine combo, and the other involves creatine. And here to help us sort out what's just a fad and what could actually help you is Dr. Kathleen Jordan. Kathleen, right?
Yeah, thanks.
Okay,
Yeah,
perfect.
thanks,
She is the chief medical officer at Medi Health, which focuses on women going through perimenopause, menopause, and post-menopause. Dr. Jordan, thank you so much for your time today. We appreciate it. So I want to start with antihistamines and antacids like Pepside and Allegra. What is that trend, and does it actually work?
Well, I'm hoping it's not a trend, but it is a conversation that's popular. So it's a conversation that started with a couple TikTok influencers sharing that they took some stuff out of their cupboard, Allegra, so allergy medicines and antacids, and felt better. So they just shared
randomly.
Just randomly.
Okay.
And then some people lobbed on some scientific theories that, well, we do know that estrogen impacts histamine, right? So it makes sense that antihistamines would work. Right? So it stimulated the conversation, and we do have people asking about it, but we haven't had a lot of patients actually using it, and so we haven't seen it as a trend.
So they're just asking about it right now.
There's a trend in the conversation.
Okay.
And I think your second question is, does it work? There is no scientific evidence that it works, right?
So
and I think
important to note that.
It's important to know because there are actually evidence-based ways that definitely work, right? It's my life's work at Medi Health, right? So it's why we are bringing care to women, but there are definitely, like, hormone therapy is the gold standard, but even if you can't or don't want to take hormone therapy, there's other evidence-based ways to do it. There's Linquit, there's Veoza, there's SSRIs, there's lots of other things you can do without resorting to your cabinet, what's in your cabinet.
Important to hear that from the experts. So we also know there are influencers out there on social media promoting the supplement creatine, which is popular among athletes for muscle growth and memory. But is creatine worth adding to your menopause care?
So creatine, I think, is more interesting.
Okay.
So, I mean, I like the conversation around creatine because when we think about creatine, we think about muscle, right? Because we store it in our muscle and it helps us build muscle. And when we're in menopause, the hormone changes actually contribute to us losing muscle mass. Our body composition changes. And for men and women, age itself, you're going to face muscle loss, right? So you have aging loss of muscle, then you have women have menopausal hit to muscle. And we want to build muscle because muscle is good for us. I think we appreciate now it's not just about looking good and tone, which is a nice thing too, but it's actually biologically active. So your muscle actually helps your metabolism work. It also helps your bone health. It helps you be more active, more stable, less falls. Like, it's good. Muscle is good for you. So in general, I do want women in menopause, and men and women, to actually build muscle. So then the second question is, does creatine help?
Yes.
Well, I have good news and bad news. So if you sit on your couch and you take creatine, it won't build muscle.
Right.
But if you do it along with fundamentals, so if you do resistance training and you have a good, adequate protein diet and you're getting rest, it has been shown that if you take creatine supplement, you'll actually get more bang for your buck and you'll actually build more muscle. So it can be additive to like an already healthy regimen.
I'm so glad you said that because that was the same thing I read. I take creatine because I wanted to build muscle because I read that as you get older, you start to lose your muscle mass. I'm thinking, okay, creatine, take it. But then there was this aspect of you also have to make sure you are working out because just taking it wouldn't do much for you.
And not just sort of the 80s aerobics, right? So
like
that's good
training.
for you.
Yeah.
So you need some kind of resistance training or weight training. You don't have to have barbells to do weight. You can use your body as a weight, do push-ups, pull-ups. So all sorts of things.
But when it comes to the memory aspect of things in your brain, does creatine help?
Okay, so this I find super cool. So we think about muscles and creatine because that's where we store so much of our creatine.
Right.
And women have actually less muscle on average, so we have less stores. But our brain, all our cells use creatine. So our brain actually uses it more than our other muscles.
Really?
So our brain will use 20 to 25% of our creatine. So if we have low muscle creatine stores, or we're not getting an adequate intake, and you can ingest it in a diet. You don't have to do it in a supplement. You can get it in your diet. You can get it in a supplement. So, but our brains are actually using more creatine than our other parts of the body. So women do report. I'm going to say this is less studied. As we know, everything in menopause, understudied, right? It's been underfunded for a while. So I do like the conversations are happening. But we do know that our brain needs creatine.
Yeah.
And we do know that women have lower stores, so because they generally have less muscle. So build muscle, creatine can definitely be additive to fundamental regimens of weight-bearing exercise. And some women report that it's good for their brain health.
And so real quick, just on the overall of that question when it comes to creatine and menopause, good or bad?
I'm going to say overall good.
Okay.
Yeah.
Okay. And so why do you think that all these trends or all these supplements or all these ideas are resonating with people right now? And there's also the fact that some of them are not regulated. So what's your advice for people?
Well, there's a lot of information out there right now.
Yeah.
And I actually like that the conversations are happening. So use, the social media. Social media is often 90 seconds, sometimes 60 seconds, right? It's not a way to deep dive onto a topic.
It's really not.
But it is a way to engage women. So we use social media to actually bring up a topic and get people asking questions. So I do like it as it stimulates questions, engagement in your health. But you need to deep dive a little bit more before you go into a whole regimen and take something for years or even months.
Yeah, so if you see something, it's important to maybe talk to your doctor and do some more research before you start to put that into your body.
Come talk to me. Yeah.
You can come talk to Dr. Kathleen Jordan. She's got the answers for you. Thank you so much for your time today. We appreciate it.
Thank you.